I also want to talk here about aged care for a second, Hollie, because I know that there are always individual examples of things that end up on the wrong side of things. But we've had royal commissions, we've had TV programs, we've had the pressure from the customers, the families, all the rest of it. And yet again, another example today about a aged care home in the north of Sydney, which is failing to address its compliance issues, right? Lots of different things, from about the way that medication is working to food, safety, all the rest of it here. I don't understand, Hollie, how the law is not clearer in Australia that if you require people to sell their house to live in your care, that when you get this wrong, you got 30 days or you are deregistered. You are gone. This is not something where you can have 700 warnings and 500 tries. People have to literally, I mean, the way we all know how it works. We all work our backsides off to have a house that one day we might be able to sell, to play money kaplunk, so we can have a comfortable end towards our life. But it's failing too many times, all sides of politics. Can we change the damn law that says you start to get this wrong, you lose the right to take people's entire wealth in exchange for care?
Anyone that's got parents in aged care will tell you the cost of putting parents into those sorts of facilities up front is enormous. And we know, though, that the staff that work in these facilities are underpaid in many instances. They're also very low skilled at times, but there is a shortage of them across the board. And if we really want to have a look at Mr Albanese, they were promising that there were going to be nurses in every aged care facility, but at the same time they're now backtracking, saying, well, actually we're going to give lots of exemptions to different aged care homes because they can't attract the staff. So there are really big problems in the staffing side of this, and things need to be done more long term to ensure that we are getting enough people working in these facilities, that these people are looked after. It's horrible. I mean, I've got a mother in aged care and the staff are wonderful and the facility's lovely, but it costs a lot of money to go in and you pay something every week, and it's an ongoing thing. So I don't know where the money's going, because it's obviously not going into paying the staff, but the people whose families are in there are paying an awful lot of money for the spot.